So, good afternoon everyone. My name is Julian Yudit. I will be performing the parenteral medications, and these medications are given through a route other than the alimentary canal. These routes are the intradermal, subcutaneous, intramuscular, and intravenous. So the equipments that I will be using is sterile syringe, needles, and ampules or vials, and sterile towel, and forceps, and cotton balls, and alcohol, and injection tray. So now, I am going to administer an intradermal injection for skin test. So, which is, the purpose of this is to provide medication that the clients requires for allergy testing and TB screening. So planning the administration of intradermal injection is an invasive technique that involves the application of nursing knowledge and problem solving and sterile technique. So we will be using a vial or sterile water, and tuberculin syringe, needle which is 25 to 27 inch of gauge, and alcohol swab, and dry sterile gauge, then medication administration record, and clean gloves. So the first step is we will perform hand hygiene first before we start the procedure. So this is to prevent the spread of the microorganisms to health professionals, and to protect and reduce potential for transmission of microorganisms. So after that, we will wear gloves. So next is we will prepare the medication from the vial ampule for drug withdrawal. And so we will prepare equipment to avoid missing steps and efficiently perform the task efficiently. So we will introduce ourselves and verify the client's identity, and this to establish a rapport with the patient and to assess necessity and sufficient condition. And next is we will explain to the client that the medication will produce a small wheal or bleb. We will providing information fosters cooperation. So next is we will provide a privacy to a patient to ensure a secure environment for patient where they receive medical care. So next is we will select a site. So next we will cleanse the skin at the site using a firm circulation motion, starting at the center and widening the circle outside to prevent exposure to contaminants. So so the intradermal should be 10 to 15 degree angle Um, so next, we will remove the needle cap, waiting for the antiseptic to dry. And to do this by pulling it off in a straight motion of decreased risk and accidental needle stick injury. So we will put this. And we will expel any air bubbles. We will expel any air bubbles, so a small amount of air will not harm the tissues. So we will grasp the syringe in our dominant hand, and we will close to the holding hub, holding it between forefinger and thumb. So the possibility of the medication entering the subcutaneous tissues increase when using angle greater than 10 to 15 degree angle. So the intradermal should we will so we will inject the skin through 10 to 15 degree angle. So now I'm going to administering a subcutaneous injection. So subcutaneous injection is place the medication into the subcutaneous tissue between the dermis muscle and between the epidermis and the dermis muscle. So the purpose of this SC injection is to provide a medication to the client requires and to allow slower absorption of a medication compared with either the intramuscular or intravenous route. So the administration of subcutaneous injection is an invasive technique that involves the application of nursing knowledge and problem solving and sterile techniques. So the equipment that I will be using is sterile water for injection, sterile tuberculin syringe, and extra needles, gauge 25 to 27 inch, and alcohol swab. Then medication administration record, and so the first step that we need to do is to sanitize our hand first. So the next step is we will prepare the medication from the vial or pills for drug withdrawal to perform tasks efficiently and introduce self and verify the client's identity and provide the privacy of the patient to establish rapport with the patient and ensures that the right client receives the right medication, and we will ensure a secure environment for patient where they receive medical care. So next is we will assess the client to a comfortable position, supine position or semi-polar position, or it promotes comfortability and easy access during the procedure. And before we will start the procedure, we will explain the purpose of the medication, including relevant information about the effects of the medication. And it providing information fosters cooperation and understanding for the patient. And we will select a site for free of tenderness, swelling, scarring, itching, burning, or localized inflammation, and one that has not been frequently used. So we will put our gloves on. We will put our gloves on to avoid contamination. And next, we will clean the site with an antiseptic swab. Start at the center of the site and clean, widening circle about 5 cm to 5 cm. Allow the area to dry. So we will sanitize the ampoules and the vial. So next, we will remove the needle cap and pulling it straight off. And we will hold the syringe between thumb and middle finger of dominant hand. I will be performing subcutaneous tissue, which is subcutaneous injection, which is 45-degree angle. So I will put the sterile water. So we will remove the excess bubbles. Okay. So we will inject the subcutaneous tissue, which is 45-degree angle. So now that we are done, we will assess the client to a comfortable position, and we will discard the uncapped needle and syringe in a disposable container, and we will remove and wash our hands, and we will document all the relevant information. So next, I will be administering intramuscular injection. So intramuscular injections are injections into a muscle tissue, and medication are absorbed more quickly because of the greater blood supply to the body muscles. So muscles can also take a larger volume of fluid without discomfort than subcutaneous tissue can. A major consideration the administration of IMs is the selection of a safe site located away from the large blood vessels, nerves, and bones. So I'm done performing hand hygiene, and I am also wearing my gloves, and it reduces transmission of microorganisms. And we will prepare the medication from the vial or ampule for drug withdrawal, and of course we will provide a privacy to our patient, and we will introduce ourselves and verify the client's identity. So this is to establish rapport with the patient, and it provides a secure environment for a patient where they receive medical care. So we will assess the client to a position depending on the chosen site. So we will explain the purpose of the medication, including the relevant information about the effects of the medication that they receive. And knowing what is happening helps minimizing patients' anxiety. And we will select site free of skin, lesions, tenderness, swelling, or located inflammation. So this condition could hinder absorption of the medication and may also increase the likelihood of injury and discomfort of the injection site. So now we will locate the exact site for injection. We will choosing the contact site allows for accurate reading of the test site at the appropriate time. So I'm done putting my gloves on, and now we will clean the site with an antiseptic swab, and use a circular motion. Start at the center and move outward about 5 cm and allow the skin to dry. Of course, we will disinfect the vial. So now we will remove the needle cover and discard without contaminating the needle, and to avoid cross-contamination. So we will change the So now I will use the ulnar side of the non-dominant hand to pull the skin appropriately 2.5 cm, and we will hold a syringe between the thumb and the forefinger of dominant hand. Inject needle quickly and firmly at 90-degree angle. So when we will injecting intramuscular, we will inject the intramuscular at 90 degree angle, and we will remove excess bubbles. So I will now change the needle. Now I will hold the syringe between the and release the skin to avoid injecting into compressed tissue. So I'm injecting the deltoid muscle at 90 degree angle. And withdraw. Cotton swab. So after this, we will assess the client to a comfortable position, and appropriate positions promote relaxation. So we will discard the handcuff needle and syringe in a safe and receptacle to prevent accidental needle stick injury. Now we will remove our gloves, and after this we will wash our hands and we will document all relevant information.